just to clarify, if someone is eating a whole food plant-based diet and their cholesterol is, 125, Dr. Cousens, are you recommending that they do something to raise that cholesterol so they're not in that under 160 zone where you're saying there's more depression in the studies you found?
Yes. Particularly if I'm seeing clinical symptoms. I mean, people come in, just like Joe was saying, or at 125 or 130, and in the bigger picture, particularly if they have depression or they have some kind of other issues going on mentally, I will want to get them up to at least 150. Coconut oil works most of the time. Besides, it's good for Alzheimer's, but it's really good for getting it up there. It's about on a vegan diet, that's about what we have.
But there's no randomized trial evidence for that yet? So it's a hypothesis?
It's more of a hypothesis. People have used it, and I've just used it clinically with pretty consistent results, but it's at a clinical level.
Joel, Brenda, if my cholesterol is 125, do you recommend I take coconut oil?
No. Absolutely not. And now, not to say that you couldn't eat some coconut and enjoy. I generally prefer for people to be getting their fat from whole foods, to be getting their carbohydrates from whole foods. So I would say if you're eating a super low-fat diet that you could afford to eat some nuts and seeds and avocados and coconut even. But I wouldn't say pour coconut oil over your food. I don't think there's any really strong evidence. And as a matter of fact, the studies I've seen really haven't even, it was addressed in the presidential report, the whole coconut oil thing. I think it was addressed very, very well. So, I mean, my cholesterol has always been around the 130. I have never been depressed in my life. And so I think there are a lot of really healthy people with cholesterols in that range. So I think we need to take it on an individual basis. If a person's showing signs of depression, then you need to see what needs to be done. And I would try super healthy diet. I would try adding the EPA for sure, a combination EPA, DHA, and all of those things first. But that would be my approach, and we all have different approaches, and you do what you find works.
Do what we need to do to help the people, and I think in defense of Dr. Cousens, he's not recommending people take coconut oil to raise their cholesterol. He's just saying in his patients that were depressed, he's doing what he needs to do to help get them not depressed, and that seemed to be helpful for them. He's not recommending all people take coconut oil whose cholesterol is low. He's just trying to help his people who are depressed.
Thank you. And I don't take coconut oil.
Just to clarify, Dr. Cousens, if my cholesterol is 125, are you yes or no recommending I take coconut oil?
To clarify it again, if you have symptoms like depression and other mental symptoms, as I said, then that will be a definite consideration. But I personally don't recommend that for everybody, and I personally do not take coconut oil. Just to be clear about it, okay? It's a treatment for a series of symptoms that could make a difference.
What is this?